Hi, I'm Dr. Embun. Welcome to our IGTV episode 2. Now we will talk about threadlift, so stay tuned! With the advent of beauty enhancement come a slew of lunchtime procedures, all in the form of minimally invasive technique with little downtime and almost instant result. Lately, threadlift have gone increasingly popular as a solution to fill the gap where anti-wrinkle injection and dermal filler fail at reaching. Threadlift literally elevates parts of the face and body without the need to create incision. And some variation of thread can reportedly brighten, tighten, and hydrate skin. The evolution of threadlifting has progressed so much that aside from the popularly known PDO threads, the market has now unveiled new threads such as PLLA and PCL. Many threads are made of PDO or polydiaphanone, have high tensile strength, but its longevity is only about 3 months. Then we have PLA or polylactic acid thread, which is a strong collagenizer, but the results aren't long term because the threads are quite soft and so they dissolve faster. And the latest type of thread is PCL. Although not as commonly used or as popular as the PDO and PLLA, PCL thread is one that can last up to more than 2 years. This is because the chemical bonds and structure in PCL are stronger and more complex. Hence, it takes a much longer time to make dissolve completely. The slower rate of degradation of the PCL threads also make it ideal to be inserted to the surrounding tissue over an extended time, achieving a longer lasting result. PCL is also known to be very potent at stimulating collagen production as compared to PDO or PLLA. Once dissolved, the material breaks down into non-toxic ordinary substance, and even after the thread has dissolved, collagen production can last for up to 1 year. Of course, the face is the most popular. Most people request for lift around the jawline as we tend to accumulate more fats around this area with age. We Asians tend to look younger in 30s, but when we hit our 40s, the effect of gravity starts showing because all the fat in the cheeks will descend and result in flatter upper part of the face. I said the age is only a number. I have a 20-year-old clients telling me they want a threadlift, but I'm not going to say no to them straight away because each person's tissue may be different. There may be laxity and we cannot generalize their skin condition based on their age. I would typically see them first and discuss the option. If it's possible not to do that, then I would advise accordingly. If they have acne fulminans, then it means that there is some infection with the bacteria in their skin, so we usually will not suggest threadlift. We will treat the skin first, not necessarily for the acne to completely clear up, but it shouldn't have infected pustule or what we call grade 2 acne. For some acne, such as dry and sensitive or dry and irritated acne, the skin will improve after threadlift. Good news. After a local anesthetic is applied, cannulas each containing a thread are inserted under the skin and directed to the area where slight traction or lifting procedure the best result. The cannula is withdrawn, leaving the thread in place. In the case of barbed threads, when the cannula is withdrawn, and the thread is slightly pulled, it causes the barbs to hook and leave the overlying skin. The excess thread is trimmed away and the tiny puncture heals within a few days. There's minimal swelling or bleeding, and most patients say that they notice minimal discomfort during the treatment. The number of thread used depends on the patient needs and the number of area being treated. Results are seen immediately, but vary, of course, depending on the patient degrees of skin laxity and the number and type of thread used. The best results when treating the brow or lower face are obtained when downward pulling muscles are pre-treated with Bostock cosmetic or Dysport to prevent potential dislodgement of the thread. Although Threadlift can lift and stimulate the skin, they do not provide the volume restoration that can be achieved with dermal filler. And since one of the main causes of sagging facial skin is volume loss, the result of using both, depending on the individual face, usually provide a better overall result. Threadlift don't remove redundant tissue like a surgical facelift can. So people with more than minimal excess skin or sagging are not good candidates for the treatment. Those with excessive sun damage, more than a moderate amount of facial fat or literally skin also should consider other treatment options. Potential side effects of Threadlift include bruising, infection, soreness, bumps, temporary dimpling of the overlying skin, and rarely granulomatous reaction. After the procedure, of course, you have to be very careful. You should avoid opening your mouth excessively wide and to refrain sleeping on one side or the other. I would normally advise my patient to sleep on a travel pillows or place two soft small pillows on either side. While the threads are not going to break, the face can droop down on one side right after the procedure, and it distresses my patient because they think that their face is not symmetrical. But this is actually uneven swelling whereby one side is more swollen than the other. Avoid putting too much pressure on the areas, no massage for at least 1 month, and no dental work for up to 6 months. Patient can risk getting infection from inside the tooth, which may spread to the adjacent tissue. Also, you should avoid eating crunchy or tough food, as you need to limit the movement of your mouth for the first month. Okay, that's all my friend. I will wait for you at the clinic. Come and see me to do Threadlift. Bye bye.